This week, we will be discussing the history of the American social welfare system. When we think about the history, we're going to be exploring different values that have guided policies and practices for social welfare during different time periods in American history. Some of the values that we need to consider include social responsibility. So do we have a responsibility to help others, or do we have individual responsibility where people need to take care of themselves? Do we need to provide aid to strangers, or do we only help those that we know? There's also the idea of individual rights. Are there certain things that individuals are entitled to, such as healthcare, housing, employment? Are these things that if they don't exist, the US government needs to step in? We also have the ongoing struggle in defining the deserving poor. Who are individuals who are deserving of help? And we have over time really seen all of these values evolve and change depending on the era. So we're going to be looking at several key eras in American history. We will not be going into thorough detail on any of these. For several of these time periods, there will be additional readings or supplemental material for you to view and complete. The first period of American history is the colonial period. So these are the first 2 centuries of American life, right as the colonies are forming into the United States. So the key event during this period is really the migration of the English and other Europeans to America. They're coming to the new land. They're viewing America as a land of opportunity. So they're fleeing religious persecution and other problems back at home. So there's unlimited possibilities in America. And because of these unlimited possibilities, a lot of colonialists view problems as pertaining to the individual. So they don't really view social problems. They don't view that it's social responsibility to help others, because if you have a problem, you should be solving that yourself. So it's really because of personal misfortune that you have these problems. It also has social welfare rooted in religion and moralistic problems. So if you have a problem, it's because of you, and you have an individual responsibility to change that. So when there have been problems, the social welfare responses during the colonial period has been guided by the Elizabethan Poor Laws. So the Elizabethan Poor Laws were passed by the English government in 1601 under the reign of Queen Elizabeth I, which is why it's called the Elizabethan. So the Elizabethan Poor Laws really established how individuals and how governments were going to address poverty. And when it was passed by the English government and then came over with the colonialists, it really said that, number one, the support needs to come from the family first, and then it's going to come from local government. So there was no federal government initiative to help poor individuals. It really strongly emphasized individual responsibility. If individuals couldn't take care of themselves, then their families could step in. And if families weren't able to step in, then the local government needed to step in. The other thing that it really defined is the first time we're defining the deserving versus the undeserving poor. So under the Elizabethan Poor Laws, the deserving poor consisted of, their quotes, lame, blind, and orphan children. So essentially it was individuals with physical disabilities and kids whose parents had passed away. So if kids were simply poor and they had 2 parents take care of them, they did not receive assistance. It's only when their parents weren't there to support them that they received care. It also provided care to people with physical disabilities. So people with mental disabilities were not being provided with care. The undeserving poor were classified as vagrants, drunkards, and slothful. So these are essentially individuals who they view them as capable of working. So they do not have a physical disability. So they are capable of working, but they aren't working. So you will be listening to a podcast this week to understand more about the Elizabethan Poor Laws and its effect on social welfare in the colonial period. Following the colonial period, the next major era that we're going to be discussing is the Civil War period. So this includes the Civil War and Reconstruction. So when the states are coming back together, so it's the middle of the 1800s. This is when social responsibility, those first seedlings of social responsibility starts. And the reason for that is up until this period, the US was seen as a land of opportunity. However, during the Civil War, thousands of individuals were killed. A lot of breadwinners were either killed in the war or were injured, and people started to see that it wasn't their fault if they became disabled and couldn't work. That's not their fault that they can't provide for their families. So there started to be some additional social welfare. Again, this is not on the federal level. So these are local governments who are providing assistance. What was established on the federal level was what's called the Freedmen's Bureau. So this is the first time we have a government intervention to provide social services. And this is for recently freed slaves. However, the Freedmen's Bureau was supposed to be temporary in nature. It was not extensive, and it didn't provide a lot of services. But this is at least the first time the federal government is providing something in the way of services. Following that period, we enter into the progressive era. So progressive, we tend to think as progressive as more liberal. So this is some more enhancement of social welfare services. This is the late 1800s, early 1900s. So during this period of time, we saw industrial expansion and urban growth. So increase in cities, increase in factories. We also have large number of immigrants who are moving to the United States, and everyone is flocking to those urban areas. So people are leaving their rural communities to urban communities. So what happens when you're in an urban community? We have, increased in tenement buildings, increased in apartments, high density, per capita density. So there's a large number of people per capita. So before, people were kind of spread out in these small rural communities. Everyone lived on farms. Their closest neighbor was several miles away. Now your neighbors are right next to you, a few feet away. And what this means is we really see more problems. So when your neighbors are right there, you see poverty. In rural areas, rural areas are those invisible poor, because you can't see them as well when your neighbors are several miles from you. But in urban areas, you see all of those problems. So when they were able to see all of those firsthand, there was more of an understanding that, hey, we have some work to do, and individual well-being is not as great as we might think. So we start to see more of a shift towards social responsibility for social problems. However, the reliance is still on these voluntary religious organizations to solve the social problems. So throughout this period, local governments have had a rather minimal involvement. Instead, it's been a lot of churches who've been, or what's considered an almshouse, which is frequently run by a church, who is providing the assistance. So two of the organizations that emerged during this period that really set the foundation for social welfare and social work. The first is the Charity Organization Society. So these are nicknamed friendly visitors. So these are individuals who, think of it as a case manager, who would go into individuals' houses and try to connect them with resources and try to assist them. The thing about the charity organization societies is they still had this idea that poverty was really rooted in the individual. So if we can fix the individual and fix their problems, then we'll fix poverty. So it was taking it on an individual level to try to fix people. But they didn't really, these friendly visitors going into the houses didn't really recognize the social basis for a lot of problems. The other thing that emerged was the settlement movement. So this is the idea that social workers should settle or live amongst the poor. So this is where social workers such as Jane Addams and Hull House established community centers and had more community-based projects. So they had tuberculosis prevention, well baby clinics. They pushed for child labor laws. So this is more on the community or the macro level for the settlement movement. It really understood that social problems were rooted in society and because of these economic inequalities, whereas the charity organization societies were more on the micro or individual level and really thought that individual misfortune was because of individual deficiencies. Following the progressive era is the Great Depression and the New Deal. So this is when we had an economic collapse in the late 1920s. And to address that economic collapse, we had the New Deal. So this was passed by Franklin Delano Roosevelt, and it really was the beginning of the modern welfare state. So this is the first time when there's widespread involvement of the federal government. So before any involvement on the government level was by local governments. Now it's the federal government saying, hey, there are major problems across the country and we need to address them, or else people are going to be left behind. So unemployment during this period was around 25%. There's increased emphasis on social responsibility, that we need to help others, again, because everyone knew someone who had lost their job in the great economic collapse of the Great Depression. So we didn't view poverty and unemployment as being an individual problem. It was caused by the collapse of the stock market. And people really started to understand and see how these problems were rooted in the economy, in larger social systemic problems, rather than individual misfortune. So we're moving further away from this religious, moralistic, individual viewpoint of misfortune, and really trying to tackle these problems on a society level. So to address these, we have the passing of the Social Security Act, which provided monetary assistance to elderly individuals. And we also passed what's called Aid for Dependent Children. So it's also known as AFDC, short version, was passed in the mid-1930s. And this is support for low-income youth. So these are unwed mothers who are low income with kids, essentially. So these are two of the big pieces of legislation that emerged, but there was a variety of other programs to assist farmers, people who were unemployed, and low-income individuals in general. So that's the Great Depression. Following the Great Depression, we're in the middle of World War II. Following post-World War II, so this is the 1940s through early 1960s, the key event during this is what's called Pax Americana. So Pax Americana, American peace. This is a time where America was the greatest power in the world, because we emerged from World War II victorious. We emerged with a thriving economy. So the economy is pumping its brakes, or not pumping its brakes. The economy is not pumping its brakes. It's pumping along, pumping the gas. And as a result, we actually move towards social conservatism. So we tend to go more to conservative. What you're going to see throughout all of these, if you haven't noticed the trends, is during periods of positive economies, we tend to be more conservative and have less emphasis on government intervention, but during negative economies, we want more government intervention. And the reason is, when things are going well, there's more of an emphasis on individual responsibility, that if jobs are abundant, then why should we help individuals who aren't trying to work? But in periods when there's high unemployment, we recognize that there's social problems that need to be addressed on the government standpoint, because there's not enough jobs to go around. So in this period, the economy is doing really, really well. Unemployment was low. There are vast disparities between racial groups, but that wasn't recognized. It wasn't until after this that those disparities are recognized. But because some people are doing well, we're shifting towards removing the government intervention. So there wasn't a lot of social reform during this period. What we did see was the establishment of the GI Bill in 1944. So we are seeing some services to some limited groups. And the two biggest groups who received services during this period are veterans and people with disabilities. And those kind of go hand in hand, because a lot of people became disabled as a result of the war. So the GI Bill was passed in 1944. People with disabilities were added to the Social Security Act. So now people with disabilities are also receiving monetary assistance. And both of these really come about because of World War II, to address those individuals. Post World War II, we're moving into the period of social reform. So this is essentially the 1960s. So during social reform, late 1950s, early 1960s, we're seeing rising poverty levels. So now the economy is not doing as well. So we're starting to understand that maybe it's the lack of the poor economy has to do with the lack of jobs, and that's why people don't have money. There's also increasing understanding of the racial disparities. So this is right in the middle of the civil rights movement. So there's growing awareness of racial disparities in a variety of outcomes. There also was a major report that came out that really gave an extensive review of just how bad racial minorities had it, especially in the South. So that really brought a lot of attention to this problem. And because of this growing awareness, along with the rising poverty, we had the 1964 War on Poverty that was established by Lyndon B. Johnson. So this was widespread government involvement in welfare. It included Head Start, food stamps, Medicare, Medicaid. It expanded aid for dependent children, so it made it easier for unwed mothers to receive support for their families. And there's also increased rights for racial minorities through the Civil Rights Act of 1964. So also an increased emphasis on trying to reduce discrimination. So we have the Civil Rights Act during this period, the Voting Rights Act, and other initiatives to reduce discrimination based on race and other groups. However, following social reform, this is a big period of social reform. Is this period of the 1960s. But what happened in the late 1960s? The U.S. entered the Vietnam War. When the U.S. entered the Vietnam War, it was a highly controversial war. Many people were against it and continued to be against it. And as a result of the U.S. becoming involved in it, number one, it shifted funds away from those social reform efforts. So there's so much money was being shifted to the Vietnam War that there wasn't a lot of money devoted to these anti-poverty programs anymore. It just wasn't available. The other thing that happened is there's this growing skepticism about the US government. So we don't trust the government. A lot of people no longer trusted the government because of the decisions they were making. So it didn't want the government involved in anything. Right now we're seeing the government's doing some things that we don't agree with. So we don't want you involved in anything. We want to be as far away from the government as possible. So during this period, there's really a scale back of federal government initiatives. Instead, when we look at social welfare programs, there's been more control to state and local agencies. There's also more privatization. So when the federal government has an initiative instead during this period, it would give money to state governments to provide services rather than it being the one to provide those services. It also gave greater control to businesses. So we start to see privatization of prisons, of school systems, of Social Security during this time period, again, to reduce the involvement of the federal government. However, we also see that there's shifting towards personal responsibility during this period, especially in the 1990s. You're going to watch it's a 15-minute video called The Politics of Poverty. It's a great video. And it discusses how the U.S. shifted from Aid for Dependent Children, AFDC, to what's called TANF, Temporary Assistance for Needy Families. We will discuss the specifics of these programs in a few weeks, but the shift of these welfare programs, it might only look like differences in a few letters or the abbreviations, but it represented a major shift from social responsibility. Aid for Dependent Children was anyone with below a certain income level with children received this assistance. However, in the shift to TANF, or Temporary Assistance for Needy Families, it was a shift to individual or personal responsibility. So TANF was passed in the mid-1990s. And if we look at the name, it's temporary. So Aid for Dependent Children, AFDC, you could receive welfare for a limited amount of time. Under TANF, if you are a low-income family, you can only receive welfare for a temporary amount of time. It can only be for up to 5 years, lifetime limit. So there's a lifetime limit. It also implemented work requirements. So it was much more challenging for families to receive assistance. So they were trying to scale back on those welfare rolls, the number of people on welfare, because during this period of time, we see an increase in the economy. Economy is doing well in the 1990s, and because it's doing well, we see the shift towards conservatism and the shift towards individual responsibility. However, what we are also seeing during this period is increased rights for specific groups. So the Americans with Disabilities Act was passed in 1990. Family Medical Leave Act was passed in 1993, which provides parent leave or sick leave for individuals who are taking care of sick family members, or if you are sick for an extended period of time. It is unpaid, but at least parents are receiving rights to take care of new kids. And individuals with disabilities are not able to be discriminated against as well, and a lot of other things in the Americans with Disabilities Act. So moving away from the 2000s, we have, from 2000 and beyond, we're really in this new century. So during this period of time, there's an expanded role of the federal government. So think about, what happened in those first 10, if we look at the first 10 years of the new century, we had 9/11. So the US implemented a variety of programs, especially surveillance programs, security programs in response to 9/11. We had Hurricane Katrina. So we had major increases in FEMA. So in emergency relief efforts, so the U.S. is taking much more of an active role. The federal government is taking more of an active role in emergencies. And we also had the recession in the late 2000s. Around 2010, we had a recession. So that's another stimulator of saying, hey, all of these things are happening that are outside of the control of individuals, that maybe problems aren't individuals, maybe it's because of things that are happening in society. So we're seeing widespread increases in the role of the federal government. We've really seen the government take much more of an active role in healthcare. So there's been this ongoing debate of, is healthcare a right? Is this something that individuals have a right to? And over time, the government has taken more and more steps to establish healthcare as a right. So Medicare now provides prescription benefits where it didn't before. It expanded health insurance for children. So now children up to 200% of the federal poverty level, which we'll talk about what that means. But more children have access to health insurance through the government. The Affordable Care Act was passed starting to be implemented in 2009, which provided expansion of Medicaid. So more poor people are receiving health insurance. You can't discriminate against people with pre-existing conditions. So just more emphasis that certain aspects of our health is a right. And if it's not, people are not being provided with healthcare, the federal government is starting to step in. So the other thing that you are going to do for class this week, because all of this is kind of the mid 2000s, to understand where we are now, I'm going to have you read Joe Biden's Vision for America. So the platform that he really ran on to really understand, he was just elected president. So what are the values that Americans were voting for? So look at his platform and try to understand what values was he voting for. And this entire semester is going to be devoted to the values that are underpinning our current society. So these are the values through the mid 2000s, but what we're facing in 2021, those values, our views of personal responsibility, our views of the deserving poor, those are things we're going to be talking about throughout the entire semester. So I look forward to tackling individuals' issues from here on out.